Good morning. This is Dr. Timothy Scott Beck coming to you from Life Point Medical. And I wanted to say good morning to you and let you know on August the 31st that we're up and ready to go and catching the messages and taking care of patients as much as we can. So if you have a problem or you need something, we want you to give us a call. You can call us at 706-782-0016 or you can text us at 706-949-1129. You can email us at office@drtspec.com, or you can go to our website, drtspec.com, and you can sign in or request an appointment online. Even if you're a new patient, this is the first time you've seen me or you need to be seen new, you go to that website. And matter of fact, if you do go to the website, we have so much of it automated that it'll automatically get you registered here in the office so you don't have to do a bunch of paperwork when you get here in the office. Unfortunately, that's seeing new patients, you have to get a large amount of rudimentary information from people so that you can do things right. I mean, knowing some of your past medical history and your allergies and your current meds and your family history and social history and all that stuff is important for us to comprehensively take care of you and to stay away from danger like allergic reactions to medicines and things like that. So please be patient with us when we try to collect information, because all we're trying to do is to make sure we get to the right spot and we do it safely. And sometimes people don't understand that, but it's imperative, and it's, to me, if I make an error because I didn't collect the right information, that's an avoidable situation. So I'm always a stickler on collecting accurate information so I don't make a mistake or don't do something incorrectly. And really, when we really want people to bring their meds to every appointment, okay, and that's actually an area of contention. People don't like to bring their meds at every appointment in their original bottles. I get that you don't want to. However, it's one of those things where if we make an error because we didn't have accurate information, that's an avoidable error. That's something that we should not have done. So please bear with us if we are insisting that you bring your meds to your appointment. We're just trying to be safe and trying to avoid a mistake that should have been avoided to begin with. Let's talk about COVID-19. First of all, we just got a new shipment of rapid tests in from the COVID consortium. And so we got 50 of them. Those tests are the rapid antibody tests, so it checks for your IgGM and IgG. And they run about $50 a piece cash because those are not covered by insurance. Okay, we have 278 reported cases here in Raven County today. That's 10 up from Friday, with no more attributed deaths, thank the Lord. And that's at 5 still, and I don't know who the 5 were, or the last 2 or anything, so I don't know who it was, but I hate to hear that. Okay, but we have more cases, but we're still very tempered, I think, than based on the rest of the country. I just want us all to be safe and continue social distancing, continue to protect yourself. And I really want to emphasize that. I think the responsibility to protect yourself is really the key here. And so wearing the mask, using the hand sanitizer, and staying out of compromising situations is a great idea. If you've got a lot of other issues like diabetes, heart disease, neuropathy, lupus, rheumatoid arthritis, all these other things that can affect your response to the COVID-19, I want you to particularly stay in trouble, out of harm's way. I did get a call the other day from a local official who was asking me about COVID-19 testing and how accurate it is and stuff like that. But I think the point that I made there, and which is really key, is all these tests, none of them are perfect. None of them are that good, okay, because it's not that long. We haven't been doing this but just for a few months. And a lot of these tests take months or years to develop and to make them right and to tweak them so you get the desired result. In other words, you get a positive when they're positive and a negative when they're negative. Okay. However, one thing I pointed out to that person, and I want everybody else to know, if you're symptomatic, in other words, you've got an upper respiratory something going on, whether it's with sinus congestion, the loss of taste or smell, runny nose, sore throat, chest congestion, all that stuff, you still should sequester yourself. And then if you have a positive COVID test, then we're pretty sure you've got COVID. Okay, we're not 100% sure, but if you're showing signs, if you are sick, if you're sick, acutely ill, and you have any of the COVID tests that are positive, that's a presumption that you are positive. Again, you can have other type of upper respiratory infections. I got you, and we can have those, and those even cross-react. Okay, but if you have a positive test and you have positive symptoms, that's enough evidence we need to say that you've got COVID-19. So, all right, I've talked too much already this morning. I want to tell everybody happy Monday, and we're here for you, and we want to see you. And we worked over the weekend, and it did really well, and the women's clinic's doing really well. So I thank everybody, and please use us if you need us, okay? Have a great day, and come see us.